learning outcomes for the module on Midstream Urine. In this module, we will cover the following points: talking to the patient before conducting the procedure, explaining each step in detail as per their gender, elaborated understanding of gathering the right equipment, understanding the details of the test and conducting it accurately, deep knowledge of the documentation sheet and the steps to fill it properly, consolidating test results for the patient and sharing it in a proper way.
So this is the midstream urine sample, and I'm going to go through the steps of it now. There's two parts to this. So first of all, I'm going to explain to a patient how to take a midstream urine sample. Then I'm going to obtain the sample from them, and I'm going to take a dipstick urine. I'm going to analyse it against the dipstick pot, which has the results here to measure it against, and I'm going to make some notes which will go with the sample to the laboratory. So I'm going to explain all that to the patient now. This should be a 15-minute station, so I'm going to go through the steps. Again, you don't need to do the full identity check, it's just acknowledging that you've done the identity check and it's correct. So I would do safe to approach, and I would do 7 steps of hand hygiene: palm to palm, back of the hands, fingers interlaced, back of the fingers, fingertips to palms, thumbs, wrists. And I'd speak to the patient. So, hi, my name's Helen. I'm the nurse who's come to see you today. And could I just check what you'd like me to call you?
Just call me Sarah.
Okay, Sarah. So I'll just assume all the ID checks have been done and correct, allergy checks, and I'm just going to ask the patient a couple of questions after I've explained why I'm here. So are you actually comfortable today? Are you feeling okay? Are you in any pain?
Actually, I've got a pain under my tummy.
Oh, right, okay. So just before we go any further, I'm going to screen the area for privacy and dignity, shutting curtains and doors. And I'm just going to explain that the whole procedure is going to take about 15 minutes. So if you're okay for that time, there's nothing urgent in the meantime. So the purpose of my visit today is that I've come to get a urine sample from you, and this is because that the doctor has told us that you've got some symptoms of a urine infection, and that we'd like to check your urine and make sure if there's anything in that urine that needs treatment. So if I go through those steps with you and you go away and get a sample and come back, and I'll test it while I'm here, and then I'll take that sample to the laboratory. It'll get tested more in depth, and any results will be fed back to you by the doctor. And if you need any more changes in your treatment, could I just check what symptoms you've got at the moment?
Like I said, I'm having pain underneath my abdomen, and then I get a burning sensation when I do a wee.
Yes.
My urine is quite dark and cloudy, and I think it smells awful.
Oh, right, okay. Yeah, that does sound like that could be a urine infection. So it is a good idea that we do take that sample now. So how strong is your pain, by the way? If you had to score it 0 to 10.
Oh, it's just about a 3.
Okay.
Stopping. I could manage.
Perhaps, yeah, if you keep taking some painkillers and make sure you're drinking plenty, because you don't want to stop drinking because you're in pain when you pass urine. So make sure you take your painkillers regularly while you've got this infection. And are you on any antibiotics at the moment?
Yes, on a short course for nitrofurantoin. I think that's what it's called.
Nitrofurantoin, okay. So I'll make a note of all those symptoms and those medications that you're on, and I'll let the laboratory know already that you're on those medications and you do have symptoms. So I'm going to gather the stuff together that you need and ask you to go away and obtain this urine sample and come back. So basically, I'm going to give you a urine sample pot with a wide neck, so it's easy to catch your urine. And I'm going to give you some gauze which is basically intact and it's in date till 2021. And I'm going to ask you to go and take these to the toilet, to wash your hands with soap and water. And I want you to wet, this is 5 pieces of gauze, so wet 2 of them and put soap and water on them, and 2 of them just with plain water on, and 1 keep dry. So you can open up the pack and put the wet ones in the plastic side and keep the dry one on the other side. Then I want you to sit down on the toilet, part the vaginal lips, take the soapy ones, and one at a time wipe down over the area where you pass urine from. Twice, 1 swipe each with the soapy ones, and then 1 swipe each with the wet ones, and dry. Then take the urine sample pot, undo the lid and place it back on, and if you just then start urinating in the toilet, after a couple of seconds, catch the urine, and then without stopping urinating, put the lid back on, finish voiding in the toilet or urinating, then wash your hands and bring the sample back to me.
All right.
Does that sound quite clear?
Yeah.
All right, so that's what I'm going to ask you to do. So in the meantime, while the patient has gone and taken the part and the gauze and obtained the urine sample, I would just check my equipment. So you could just put some urine in there. I would just check that I have the urine dipsticks, which is one of these bottles. These are the ones they're using in the OSCE, and this is the form they're using to put the results on. And we would check that this had been kept in a dry, dark place, so it's been stored appropriately, that it's in date, so it's in date till 2021, and happy to use that. I'd need a pen to write the results, some gloves and an apron. So I'll put my apron on. I've also got a disposable tray to run the urine test in. So I'm going to don the apron. And get some gloves on. And ask Sarah for the sample back. Thank you, Sarah. So I now have the urine back, and I would place that into the tray, just so that there's no splashing everywhere. So I'm going to take the urine stick, and I'm going to keep it in my left hand, because I am going to write with my right hand and keep that dry for writing on the form. And so I'm going to have to do this left-handed and compare it against the numbers or the colours which are numbered on the sample pot. So it goes round in time frames that you have to read. And the first one says glucose, and it says 30 seconds. The second one says ketones, KET, which is 40 seconds. Then it goes SG, specific gravity, 45. And it says BLO, blood, 60 seconds. pH, 60 seconds. PRO, protein, 60 seconds. NIT, nitrate, 60 seconds. And LEU, which is leukocytes, which is 120. So we have to verbalise how long we're taking with each one. They're the optimum times to take these samples from, to read these samples. So I'm going to do that now. So I need to dip this for no longer than a second. And then I'm meant to just scrape the excess urine off on the edge of the pot and just put the lid back on. Obviously, that's quite important to put the lid back on. Put that out of the way for now. So after 30 seconds, I am going to read from the pot what the results are. So the first one's glucose, and that's 30 seconds is gone, and that is actually negative. So I'm going to put a tick in the negative box. 40 seconds is gone, and the ketones is showing a trace. So I'm going to put a tick in the trace box. Specific gravity is not showing much, but it's showing a little bit. So I have to match the colour up. The colour's coming out as third box along. So I'm going to put a tick there, and that's 45 seconds, 60 seconds, and I've got to the blood part, and that again is showing there's two parts to the blood sampling. There's hemolyzed and non-hemolyzed. So in the non-hemolyzed, it just shows dots of green. So this has dots of green, so it's non-hemolyzed. When it's a solid colour, it's hemolyzed. So this one's showing 2 pluses of non-hemolyzed blood. So I'm just going to put a tick in that box. And then pH is normal, it's 5. Protein is showing a trace, so I'm going to put a tick there. And still 60 seconds for nitrates, and that on the scale shows either positive or none at all. So it's showing positive, any sort of pink, pale pink or darker pink. And so it's showing a pale pink, but I still tick it for positive. And leukocytes is showing 2 pluses, so it's a moderate amount, so I'm going to tick that. And that was 120 seconds for leukocytes. So I would just make sure that I've checked the labelling on this urine sample correctly, and I would put it in a plastic bag, which would be sealed, and then that would go to the laboratory. I would now get rid of this into the patient's household waste. If I was in hospital, I'd put it into the clinical waste. Just going to put that into patient's household waste. Take off the apron and gel my hands. I would just go back and give the patient these results. Make sure that their name is on the form. So we've got Sarah Wilson, and the date today is the 1st of the 11th, 19. So I'm just going to tell the patient the results. Okay, so Sarah, having checked your urine, I've seen there's quite a few things in there. So you don't have glucose, and there's a little bit of ketones. It's showing specific gravity, so there's some stuff in there, a trace of blood, which could be indicative of a urine infection. Also a little bit of protein, which doesn't really indicate anything in particular. Nitrates and leukocytes could be a sign of urine infection. The laboratories are the ones who can test this properly, and they can make a proper analysis and tell us if your tablets are working, and whether there's any. They'll give the doctor these results, and they'll make a decision whether your treatment changes or not. Is that okay? Do you understand everything?
That's perfectly fine, thank you.
Okay, so just in the meantime, again, I would recommend that you drink plenty of water. 2 to 3 litres a day is ideal. Eat a protein-rich, mineral and vitamin-rich diet, and good hygiene is always good around the area when you've got a urine infection. So just make sure you clean more often when you've passed water is a good idea. Okay, keep your hands clean.
Thank you very much.
All right, so that was the midstream urine sample for the OSCE.